Hello class, in this video you will be learning about the four categories of immunity. The first one we call the naturally active immunity, and then this is when we are producing antibodies in response to the exposure to a pathogenic infections. So this is the normal process. Whenever we are exposed to any pathogens, then we will get sick, and then after that the immune system will start to learn about these pathogens, and then they will start to produce this adaptive immune response, and then that's what we call the naturally active immunity. Now if we want to train our body about different pathogens without getting the disease, this is when we will go to the artificially active immunity. And with the artificial active immunity, we are producing antibodies in response to the controlled exposure to vaccines. And then this is the principles of vaccinations. So if we are injecting the body with part of the pathogens, then we can elicit an antibody response, and then this will help us to get immunity against that pathogens. Now another way of getting immunity is what we call the naturally passive immunity, and this is when we are receiving antibodies from another organism. So on this one we call passive because there is no activation of the adaptive immune response. We are only going directly to giving the antibodies. So the body is not producing antibodies, we are injecting the antibodies. Naturally occurring, this has happened through the mothers to the baby. This is when all the IgG, they can be transmitted through the placenta to the newborn. And then that's why the newborn, usually they are protected for about 6 months against different pathogens that the mother was exposed to. Now after the 6 months, all these immunoglobulin, they will start to break down, and then that's when the child will start to get certain illnesses, and then they will start to get exposed to the environment, and then they start to have their own immune system. Now another way to expedite the healing process, this is what we call the artificially passive immunity. And then this is when we are receiving manufactured antibody via external delivery. So we can either manufacture these antibodies and inject it to the patient. So over here they can respond to the infection without activating the immune system. And then that's what we call artificially passive immunity. So you need to understand the difference between those four categories. So naturally active, that's the normal process when you're exposed to the pathogens and we develop immunity against them. And artificially active, this is when we are getting the vaccines. And naturally passive, this is when the baby is receiving the antibodies from the mother. And then artificially passive, this is when we are injecting the antibodies directly to the patients. Now lastly, we have a term we call the herd immunity, and then this is when we are vaccinating most of the population in order to protect those who don't get the vaccines or they cannot get the vaccines, and then that's what we call the herd immunity. And the herd immunity simply is to prevent epidemics from happening, because certain bacteria, they require a certain amount of host in order for this infection to spread. So if we vaccinate most of the population, then these pathogens, they cannot spread in that community. So herd immunity, that's happen through vaccinations of the majority, and then this will prevent the epidemics of certain pathogens. Now over here there are a couple examples, and I want you to read through these questions and try to get the answers for each one of them.